Candice Wells, and today I will be showing you how to feed somebody through a feeding tube. There are two different types of feeding tubes, one of which is called a nasogastric feeding tube. That tube is inserted into the nasal cavity, down the esophagus, and into a patient's stomach. The tube of which I will show you today is called a gastric feeding tube, also known as a PEG tube. That tube is surgically placed in a hospital setting. This particular tube is held in place by 2 stitches. There are many reasons a patient would need a feeding tube, the main reason being a patient's inability to maintain adequate nutrition. Other reasons include patients breathing in food, which instead of going into their stomach, they would be breathing that into their lungs and would be at high risk for aspiration. Another reason is a patient's inability to swallow, which my uncle currently suffers from. A few months ago, my uncle suffered a stroke that affected his ability to swallow. If he is given any food or liquids, he would be at very high risk for aspiration. There are many different types of feeds prescribed by doctors. All patients need different caloric intakes. My uncle needs a 1,500 caloric intake. He receives 6 boxes of feed each day, each box containing 250 cc's. These feeds are done every 6 hours, and he also needs an additional 300 cc's of water. He receives 100 cc's of that water before his feed. He includes 100 cc's into the 250 cc's of feed, and we finish off our feed by flushing with the remaining 100 cc's of water. To begin, I'm going to make sure that my hands are clean. I'm using hand sanitizer. My hands are all clean. I'm going to begin by checking for placement of the tube. Everything looks good. There's a plug here at the top of this feeding tube. I'm going to unplug that and insert this 60 cc syringe. You will want to make sure it is firmly in place, as you usually only have one hand to hold both the tube and the syringe in place. I am then going to take this white clamp and unclamp it as that frees the tube, allowing the feed and the water to go in. I'm going to begin by inserting the 100 cc's of water. Being that the syringe only holds 60 cc's of water at a time, that is all we insert at one time is 60 cc's. As we see, everything is running down smoothly. I am then going to take the 250 cc's of feed and begin inserting that into the tube, 60 cc's at a time. If ever you feel that your feed is going down slowly, we can use what we call a bulb syringe, which you are going to put onto the 60 cc syringe, gently squeeze, and that is going to force the feed down just a little bit faster. I again am going to use my bulb syringe. Just a gentle squeeze, and that allows that feed to go down smoothly. Again, we'll use our bulb syringe. are all done with our feed, we are going to use the remaining water left in our cylinder and flush down the tube. And as we see, everything has gone down our tube. I am then going to clamp the tube. I can then take out my 60cc syringe, and you're always going to want to make sure that you plug your feeding tube and that it is clamped. My uncle prefers his to be tucked up under his shirt so that it does not get caught on anything. We do not want to be at risk for having to go back to the hospital and have this surgically put back in. At this time, I would like to say that gastric feeding tubes, although they may seem more permanent than a nasogastric tube, they don't always have to be. My uncle is currently undergoing weekly therapy that checks his ability to swallow. He, in the last couple of months, has shown immense improvement, and we are hoping that one day he's not going to need this gastric tube, as he is now able to take in nectar thick liquids and pudding thick foods. At this time, I would like to thank my uncle for giving me this time and letting me show you how to feed somebody through a tube. Thank you.